Hello everyone, Dr. Amy Mercovich here, posture expert and chiropractor. And today we're answering the question is how to lay around in a hospital bed post-surgery or with an illness so that you don't wreck your spine. Now if you're a caregiver, you want to particularly pay attention if you have a mom or someone elderly who's going to be recovering in a hospital for a while. You want to really make sure that your eyes are on their posture and their spine, because no one else is going to look at that. And I've seen one really bad thing happen to a lot of people who have spent some time lying around in a hospital where it wrecks their spine normal curves from the side view. So what I want to point out and what the take-home message is you're trying to prevent, if this is the bed and it's elevated, okay, so this is someone's bed, and I'm not a great artist, but that's okay, that you don't want someone to be all day long on the bed with their spine going like this in one big C curve. So what happens is instead of keeping the neck curve and the lower back curve while you're lying in bed, the spine becomes one big slouchy C. And then after a month of coming out of the hospital laying that way, this is the way that they're left, like this. And then they become more and more forward over time. And I've seen this many times happen, and it's so preventable. So as the person in the hospital, if you're aware of this, or you're the caregiver of someone and you're visiting mom or dad or someone in the hospital, don't let this happen to them where they lose that curve and become one big C. So what you want to do is simply, they're lying in the bed and they're elevated all day long and they're sitting here, you want to put something in behind their lower back. Let me redo that. So neck curve, mid-back curve. Now the lower back curve, we don't want it to continue to be a C, so we got to stick something in there, and then the legs are down here. So you need to put something in right there behind their lower back. And the more specific and firm it is, the better. A rolled up towel that's rubber band and firm. And you don't put it down on the tailbone, you want to put it just above the tailbone so it keeps this curve in here. And I know I'm a terrible artist and my drawings are terrible, but the take home point is so important that if you're sitting in an elevated bed, you need to put something behind the lower back curve to not let that spine get deformed in that time of laying around. And then support the neck curve, and another comfortable thing for that person is a little pillow behind the knees or the upper thighs. And all of that will make them comfortable and will not let their spine be wrecked.